It is my great honor to introduce our keynote speaker from Los Angeles, California, Dr. Indu Subramanian. Dr. Subramanian received her medical degree in 1996 from the University of Toronto, Canada. She is a clinical professor of neurology at UCLA, and she established the Movement Disorder Clinic at the West Los Angeles Veterans Administration and has assumed the position of the director of the Southwest Parkinson's Disease Research, Education, and Clinical Care Center of Excellence in Parkinson's Disease. She has developed a strong interest in integrative medicine with a special interest in yoga and mindfulness. She recently got board certified in integrative medicine. She is also very passionate about palliative care and is the host of a virtual support group with world experts in PD and co-edits a blog for individuals with Parkinson's disease. So without further ado, I'd like to welcome Dr. Indu Subramanian.
Hello, and thank you so much for inviting me to be your keynote speaker today. I'm just so excited to be part of this conference and some excellent speakers. And I think you're going to be hearing some themes throughout the conference that will hopefully resonate with you. A number of our speakers today will be talking about similar things about how you can empower yourselves to live better with Parkinson's disease. So this has really been a passion of mine, and I hope to share some insight from some of the research that I've been doing and also kind of help you solidify some of these concepts so that you can try to pick and choose things in your wellness strategy to live a better, more holistic way of living, improve your quality of life. So without further ado, I'll share my slides here. So I'm going to be talking to you today about what constitutes wellness in Parkinson's disease. And I think a number of the speakers today will be talking about some elements of this. And I have a yoga teacher background. I have some mindfulness teaching background. I've really been interested in integrative medicine. Hopefully I can teach you a little bit about these things and how to weave in some of these concepts in your own Parkinson's management. So thinking about the historical aspects of Parkinson's disease is named after James Parkinson. He was a doctor who had witnessed some patients about 200 years ago. He wrote this essay called The Essay on the Shaking Palsy, and largely he talks about the motor aspects. He talks about involuntary tremulous motion with lessened muscular power, with parts not in action and even when supported, with the propensity to bend the trunk forwards and to pass from a walking to a running pace. The senses and intellects being uninjured. So he really talks a lot about the motor aspects. I think he nailed those really well. Really some of the non-motor aspects he really didn't talk about very well. When we think about sort of the historical concept of how clinicians like me are educated about Parkinson's, it's really around some of these sorts of drawings and sort of the motor aspect of Parkinson's. So I learned this mnemonic, tremor, rigidity, akinesia. These are the things that we look for in Parkinson's patients, balance issues with postural instability, really focusing on motor aspects. I was educated around these Netter drawings back in the day. As you can see, they're largely depicting white men through various motor stages of disease. And this was, really a concept and the stages kind of conceptualized in the 1960s. So I think, we really have to sort of update our concepts. And I think, the pandemic has really been a time to think about these things differently. When I was educated about Parkinson's, we really thought about the sort of protein, the substance, the sort of Lewy bodies that were being deposited in various parts of the brain, ascending through the nervous system. And by the time people presented with motor aspects of Parkinson's, that there was already this concept that these proteins had already been depositing for a number of years, leading to a number of motor aspects. But I think many of us who take care of Parkinson's patients are really passionate about this, really are thinking more about the non-motor aspects and what really makes a difference for our quality of life. And really the motor aspects, these sort of concepts that I showed you in these pictures are really just the tip of the iceberg. And so much of what we're really dealing with is sort of things around the non-motor aspects, the mental health burden. And so really conceptualizing the concept of Parkinson's in a little bit of a different way, we have this concept that people have this predisposition with a number of non-motor issues, sometimes fighting in their dreams, sometimes a change in their sense of smell, anxiety, depression. Many of these things can happen 15 to 20 years before people ever walk into my office with Parkinson's symptoms. People present then with motor symptoms, eventually to a neurologist. We then follow people over a number of decades. And really, there's sort of this concept that the motor aspects are really king, but really what we're really realizing is that what really makes a difference for our patients and their caregivers is really this host of non-motor aspects. So really things like sleep dysfunction, mood issues, cognitive issues, depression, anxiety, things like that. And so really, can we really think about this timeline in a very different way? this drug right here, carbidopa-levodopa, or Sinemet, as we describe it in the United States, is something that's been around for almost 50 years at this point. It's an old drug, but it's still a very good drug, and it really helps a lot of our motor aspects of Parkinson's. But really the concept is that we really have some pills. We've been repackaging Sinemet in different sorts of formulations. We've been looking into new sort of ways to tackle Parkinson's motor symptoms with brain surgeries and things like that. But can we really think about this paradigm in a different way and find ways to really think about wellness, and where to drizzle this in is really some of the work that I've been doing, and some of the other speakers hopefully will also convince you that this is important as well. So what is wellness? Wellness is not the opposite of illness. What I like to use this definition of wellness is that it's the active pursuit of activities, choices, and lifestyles that leads to a state of holistic health. And so one can consider this sort of in this paradigm of Parkinson's, and think about what are the things that you can choose as patients, and you as caregivers can help your patients at home choose to do to really sort of empower you every day with lifestyle choices, where you as the person, you as the patient are in control. There's a sort of multidisciplinary, holistic aspect of things, and really thinking about lifestyle as a very important piece of the puzzle to help patients with Parkinson's. So when we think about the sort of concept of regular medical care, this is what I was really educated around in my medical school, that the patient comes to see me, I wear a white coat in an office, the patient complains about a symptom, I treat them to try to treat that symptom. It's very corrective, it's very episodic. I see you once in 6 months if you're my patient, I see you maybe for 15 minutes if we're lucky, sometimes 30, depending on the occasion. And it's very, very episodic, compartmentalized care. And really, I, as the doctor, am responsible for giving you a prescription that you will follow. The wellness paradigm really changes that. It really puts the patient in the driver's seat, thinking about ways to help you thrive, not just cure symptoms, but really improve the holistic aspects of your health, really thinking about things that you can incorporate every day into your day-to-day life, ways to make you responsible for your own health, and hopefully lead to an optimal state of well-being. And so it's really this kind of different kind of concept that I've been really thinking about in terms of how to help our patients with Parkinson's to incorporate this into their daily lives. So wellness is a bit different than just happiness or well-being. These are much more subjective sorts of things. And I think one of the problems is with the concept of wellness is that we've sort of branded this in not a great way in modern life. And so there's sort of this industry which makes a lot of money off of things that are branded as wellness. We think about things like yoga with expensive yoga mats and cute yoga clothes. And really, I think we've sort of done a disservice for this whole concept of a more holistic way of living. And the wellness industry has, done a very good job of marketing this, but I really think at its core, the tenets of wellness are really very pplicable to Parkinson's disease. So I work in a VA. I run our Center of Excellence at the VA, and it's my pleasure to take care of this sixth of the US, so the Southwest United States, all the way into New Mexico, Arizona, Las Vegas included, and half of California for veterans with Parkinson's disease. The VA has been really actually open-minded to some of these concepts of wellness, and really talks about this concept of whole health. So when you look at this paradigm, you think about the patient in the middle, thinking about all the things that surround the patient, including the people that love them, their family, friends, and coworkers, things like their surroundings, where they live, and a number of lifestyle choices too that we'll touch on: food and drink, recharge, power of the mind, power of moving the body, things like that. And so really thinking about all of these things surrounding the patient in terms of lifestyle choices and social support, and then thinking about what can we do to prevent, not just treat, thinking about other approaches, not just conventional treatments, and then also thinking about the community at large in which the patient lives. And so I really love this concept of this whole health concept. Wellness, I think, is important to think about in a cultural concept too. And so the cultural context, I think, of trying to help people empower themselves is really important. I think when we study things like, doing a treadmill for 30 minutes a day, and then we say, you need to do 30 minutes a day in the gym on a treadmill, this is only applicable to a certain subset of patients. Some people may not have access to this. Some people may not find going to a gym. If you're a Muslim woman living in the UK, this may not be something that would be acceptable acceptable culturally to you. So I think we really have to think about the cultural context of when we're writing these prescriptions, meet people where they are and really help them find lifestyle choices that they themselves can find themselves doing really, and that will help them thrive. So I love this way of looking at things, and each culture has different concepts of wellness, but the First Nations in the US here has a concept of the person in the middle, emotional, mental, spiritual, and physical ways of thinking about wellness, thinking about things that are important to these people. So thinking about their ancestors, thinking about their tribe, thinking about wisdom, respect, relationships, and responsibility, really at the core of some of their cultural beliefs. Thinking about the land and the other nations, for example, thinking about their community and family. These are things that are very important to people. If you don't include these, it's really doing a disservice for thinking about how people can really thrive. And then really looking at sort of these other concepts, environmental, social, economic, and cultural. So I think, we have to really think a little bit more about a broader definition of wellness and not just, going to the gym or eating, 7 colors of vegetables in a salad. So I ended up getting boarded in integrative medicine. I was really interested in sort of yoga and mindfulness. I ended up doing some deeper dives in this and taking a board exam in this integrative medicine, which I think is a really cool kind of intersection between Western practices and these sort of Eastern approaches to care. And so I'd like to teach you a little bit about this. So in many of the Eastern sort of ways of approaching health, there's really this concept that there's an innate healing process within people, that the body is very resilient, and that there's sort of this very holistic approach to living. And so it's not just taking a pill, but really the lifestyle-oriented choices that one has every day that they can incorporate. So I think this jives actually very well with the World Health Organization's definition of health, which was created in the 1940s, actually. And it's actually a very kind of open-minded approach to health that unfortunately we've sort of kind of come away from a little bit as we've sort of modernized healthcare. So the World Health Organization defined health in the 1940s as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So when I think about ways to help our patients understand how to incorporate wellness strategies, I think the first thing is to understand sort of what is your purpose. I think each of us as people living on this planet need to have a sense of purpose, something that brings us meaning, something that brings us joy that we look forward to every day. What are your priorities in health? And this could be very different for each person. For some of my patients, it's being able to play with their grandchildren on the floor with their toys. For somebody else, it might be joining their wife on the golf course every day. For somebody else, it might be staying in their dental practice. So everyone is very different. And I think it's important for us to understand and actually introspect a little bit on what really is our purpose and what brings us meaning and joy. Another thing that I think you're going to be hearing about throughout this conference is really about the fact that exercise is medicine. I think that exercising every day is absolutely important, but finding the things that you love that you're going to look forward to is really key. So if that means engaging a physical therapist, engaging a yoga teacher, engaging a coach, finding ways to keep at it, but really thinking about sort of things that not just affect, aerobic sort of exercise, but ways to also challenge your mind-body sort of approaches, as well as stretching and flexibility, are hugely important in something like Parkinson's disease. Staying mentally active is very important, and some people find this very overwhelming, but sometimes finding bite-sized things. So if it's reading, maybe rather than reading a whole book, finding short stories, finding things that engage you, maybe looking through old photos, finding things to kind of resonate with you, maybe writing stories, writing in a diary. These are ways to stay mentally active. So think about the things that bring you joy in this arena. Sleep, I think, has been hugely undervalued. I know that I in med school learned very little bit about sleep, but it really is so important. This is really when you're going to recharge your batteries, when a lot of detoxification occurs. In Parkinson's disease, this is hugely fragmented. And so if you can try to get 8 hours per night, and for our caregivers out there as well, this is hugely important. So really make this a priority and try to find a way to wind down at bedtime and get that good night's sleep. Food is also hugely important. There's some information out there about various types of diet. I think the diet that we really try to encourage the most is really the Mediterranean diet. So thinking about lots of fresh fruits and vegetables, lots of whole grains, seeds, legumes. If you can get as many colors of the rainbow as possible, I know it's not accessible to everyone, but really think about that as best you can. Lots of fiber is very helpful to our patients as well. Hydration is hugely key in Parkinson's. If you get dehydrated, often people can feel a lot worse. So aiming for, if your other health conditions allow it, for 8 glasses of water, if you can, per day, it's hugely helpful. I'm going to spend a few minutes on these last couple of wellness strategies. So the mind-body approaches, this is something that I've been really interested in. I have a yoga teacher background and have also been really interested in mindfulness. And these are really, I think, becoming more and more exciting sort of in the sort of advent of COVID and really thinking about the things that have allowed us to kind of get through the pandemic. Many people have really relied on some of these practices. It may not be a formal sort of practice of meditation or yoga for you. And if you look at this list here, maybe there's other things that are more available to you. Some people, prayer is actually deeply meaningful. And this is actually also a mind-body approach, getting out in nature, spending time in the garden, spending time hiking in nature. These are also approaches. Singing, dancing, playing music, art, doing things, all of these things can actually be also approaches that can really tap into the same spaces. And so thinking about all of these sort of lists, find something on here that may resonate with you and find ways to cultivate it, I think is really helpful. So there's been some studies in this space, probably one of the oldest studies in the Tai Chi literature is from 2012, showing that there was improvement in certain sorts of arenas of balance and things that reduce falls. And so this was a paper that has been cited many times. I'd also like to spend a minute on yoga. This is something that's been really interesting to me. I know that there's some yoga in this conference as well. So what is yoga? It is actually not all of these sort of contorted pretzel-like figures. It's really a very kind of cool area of practice that can actually lead well into aging, well into geriatrics years. It's been studied in geriatrics populations and is safe. And it's really kind of interesting because yoga has been sort of brought to the West by this gentleman, BKS Iyengar, who himself rehabbed from a pretty bad lung problem in his teens. He also rehabbed from an accident that he got into in his 60s and really was able to use the modifications that are around yoga and really sort of allow himself to continue to practice well into his late years. I think he just died a few years ago and really was practicing yoga into his 80s, having been in various sort of ill health throughout his lifetime off and on. So we ended up looking at some yoga studies and looking at the benefits. There's a paper in 2014 that looked at the benefits of yoga largely in motor standpoints. And there was many of these studies have been relatively small historically. And there's been some other studies more recently looking at non-motor outcomes, looking at things like depression, anxiety, quality of life. And this was probably the most recent well-done large study. This was a study published in JAMA Neurology in 2019, looking at the benefits of mindfulness yoga versus stretching. This incorporated some breathing. It also incorporated some meditation, and it also incorporated some yoga moves, and actually showed benefit in a number of aspects, including depression and anxiety. So I think we have some mounting evidence that shows that yoga actually has benefits in various aspects of Parkinson's disease. And we'd like to continue to study this and try to incorporate more non-motor outcome measures and quality of life measures moving forward. So I think, I think if you can find some way to tap into the mind-body approaches, I think that's, definitely something that we recommend. So I'm going to shift gears a little bit into another area that I've been actually very passionate about, and that is around social connection. So we ended up doing a study that was published last year in Nature Parkinson's, looking at the effects of social isolation in Parkinson's disease. And this was actually a very interesting kind of area of study. As I got more interested in this area, I was really just fascinated by how much literature there is in populations in general. So in populations populations in general and in aging populations, we know that being lonely is actually pretty detrimental to your health. It's as bad for you to be socially isolated as smoking a half a pack of cigarettes a day or being obese. And so this is a pretty big social determinant of health. In veterans, loneliness has been associated with depression, anxiety, and substance abuse, as well as suicide. There was really very little research on this, what I consider this basic human nutrient, just as essential for people to live as food, water, and shelter. And so we ended up studying this actually pre-pandemic. And in the pandemic, this research became all the more important. So just defining things. So social isolation is something in which we can actually measure how many social interactions people have, who they live with, things like that. Loneliness is more the subjective emotional state in which people have this sense of what they already have in their own day-to-day social interactions and what they desire in terms of their social interactions. And it's really this gap between what people have and what they desire is really what constitutes this feeling, subjective emotional state of loneliness. And so we ended up looking into this a little bit more. And I came to find out that in order to not feel lonely, you actually have to have 3 spheres of connection in order to not feel lonely. And so one sphere is that intimate sphere. So we have maybe a partner who's a close confidant or emotional partner. This could be a spouse that lives with you at home. So if you have this, this is one of the spheres that is, helpful to not feeling lonely. The other 2 spheres, though, are also important to have some relationships within. So the second sphere is that of relational loneliness. It's this longing for close friendships and social companionship. And so that might be a friend circle that you have. And the third sphere is actually a collective loneliness sphere. So this is a need for a network or a community of people who share your own sense of purpose and interests. And so again, there's this intimate sphere, the relational sphere, and then this collective sphere. And you actually need something in each of these in order to not feel lonely. And so I was actually pretty surprised because I would see people who seemed happily married, and I would assume that they weren't lonely, but it's actually possible for that couple to feel lonely together, or the person within that couple to feel lonely because they don't have, a friends network or this other collective sort of connection, maybe with a higher sort of group of folks that may share a purpose or a meaning with them. Like, for example, for my veterans, it might be being a veteran, or for some of my Parkinson's patients, it might actually be some advocacy or belonging to a Parkinson's group. So really, we ended up going into this study, looking at some of these aspects. We know that loneliness can affect things like stress. It can increase your stress hormones. It actually can affect your immune levels and make it harder for you to fight infections. It can affect your cognition and make you sometimes fixate on more things that are negative. Sometimes more socially threatening stimuli can be fixated on, and it can also disrupt our circadian rhythm and affect sleep. So you can imagine going into the pandemic, there was a real concern that, if people got socially disconnected, that our patients with Parkinson's might get more at risk for having problems in many of these arenas. So looking at our data, the bottom line of our data showed that it's as bad for you to be lonely as the beneficial effects of exercising 7 days a week, 30 minutes a day were good for you. And so this was a pretty profound takeaway. And so you can imagine if you're isolated and you're not exercising and you sort of withdraw socially, that this can be a double negative. But in that sort of empowerment, thinking about your wellness strategies way, if you can find ways to connect socially and exercise, it's actually a double benefit, or a double plus. So we really want to think about that in picking activities every day in our lifestyle choices to see how we can benefit ourselves. When we looked at this sort of outcome measures too, what we found is that if you are lonely, this is this thin blue line here. These the shaded thing is the not lonely group. So when we look at things like the non-motor results in sort of non-motor symptoms, the lonely people seem to have much more things like fatigue, insomnia, anxiety, depression, motivation. All of these things seem to be worse in the lonely group as compared to the ones that seemed like they were not lonely. This also was seen in the motor aspects of Parkinson's as well, but it was much more sort of seen in this non-motor aspects. So we were really kind of concerned thinking about this data, how loneliness affects our patients, how it affects them in the non-motor realm. And really we're dealing with this sort of synergy of pandemics, not just are we dealing with sort of this concept of Parkinson's. This is increasing numbers of patients with Parkinson's in the world. It's doubled in the last 40 years, slated to double again in the next 20 years. Then we had this loneliness pandemic even going into the COVID-19 pandemic, with a lot of people becoming increasingly socially isolated, and then enter COVID-19. So there's this really concern about what we could do proactively to help our patients. And this was a graphic that was put out very early in the pandemic, thinking about social isolation, stress, and physical inactivity as added burdens of COVID-19, this concept of this potential downward spiral effect. And what were really the saviors of the day, I was excited to see proposed were things like socializing online, mindfulness, and home-based online workouts. So really, what are we able to do proactively to try to help patients with Parkinson's? There's this concept that social isolation may lead to worsened stress hormones, as I mentioned, worsened immunity, disrupted sleep, worsened motor and non-motor issues, and then this possible increased downward spiral as people get more apathy, more anxiety, more depression, leading to more social disconnection, this potential downward spiral. What can we do to intervene? Well, we postulated that social prescribing, sort of literally prescribing social connection for our patients, was a way to hopefully break this cycle. So I'd like to teach you a little bit about social connection. So really what we were telling our clinicians to do was ask people how they were doing, how they were connecting in these three spheres, find proactive ways to try to help keep people connected with things like virtual phone calls, possible virtual support groups, things like that. And so the social prescribing concept, where people are literally having ways that a clinician, as a doctor, I can write, or a physical therapist or a social worker that's seeing you can possibly, connect you with social resources that might be in your community, things like gym or exercise classes, art-based therapy, volunteer opportunities, things like that. This was written about in the New England Journal of Medicine in 2020. There's actually been great models for this in the UK. This is, for example, the Northwest Social Prescribing Network in the northern UK has a lot of different things, including religious and spiritual groups, community groups, a number of other social organizations to connect people with. We at the VA were able to have this referral to the Compassionate Contact Corps, which is at the VA. It's for veterans. So I, as a clinician, can actually identify patients who are at risk for being lonely and connect them to a group of volunteers that can proactively call on them, either through the phone or through a video chat, and sort of check on them every week. So it's kind of this cool concept of literally prescribing social connection. We ended up talking to the New York Times about this concept at the VA, and it's been kind of a really interesting sort of novel concept. And I urge you, many of you may be belonging to your own support groups, and really think about ways to kind of find people that may be disconnected and connect them with your social networks in whatever proactive way you can. So I've been actually running a virtual support group this past year and a half with the PMD Alliance. A lot of these have been interviews of world leaders in Parkinson's. A lot of this is already actually on YouTube. You can Google PMD Alliance and look under holistic, which is the title of many of the talks that we've been talking around. And I've also been blogging on parkinsonsecrets.com to try to help our patients feel connected to resources in this very sort of troubling time. A lot of good resources on that blog as well. So thinking about ways to socially connect, finding your tribe, finding your cheerleaders, finding your neighbors, thinking about online resources. I think I really urge you to think outside the box in whatever way you can, because I think we've really undervalued the importance of social connection. And so, sometimes it might be reading over Zoom to a grandchild that you haven't been able to see. And I've not just been giving this advice, I've been taking it myself. We've been meeting weekly with my parents who have been up in Canada. My sisters live in different parts of the United States and have little ones. These are my three boys. And really, we've been doing this weekly over Zoom to try to stay socially connected. We've celebrated birthdays and Halloween and all kinds of other things. So really urge you to think about that. So what are ways to screen for people who might be lonely? Well, this question, we looked at the UCLA questionnaire, the loneliness questionnaire, and the question, do you sometimes or often feel left out, seems to be the thing that is the highest yield. So we've also been urging our clinicians to try to get our patients out of the house a little bit around some further surveys that we've been doing. So the things that really impact our patients in a positive way from a social connection perspective and quality of life perspective include pretty simple things, actually. One is trying to get out of your home most days per week. And it doesn't even matter really what you're doing. But if you can get dressed and get out of your home, that seems to be beneficial. And then connecting with someone daily, either through the phone or video modalities, also seems to be a pretty simple thing. These aren't expensive or, really, kind of mind-blowing sort of things. These are relatively simple things, sometimes visiting safely with friends and family, yoga, Tai Chi, as I mentioned, joining a club. It doesn't even have to be a support group for Parkinson's. It could be a bird watching club or something else, a gardening club. But think about ways that you can really connect. And just as a final couple of statements, I think that we've spent a lot of time thinking about the wellness of our patients, but I think, it's also very important to think about our caregivers out there. I know many of our caregivers have been really had to do a lot more heavy lifting because a lot of the things that they may have had for respite have been closed off for the last 18 months. So we do think about you as well, and no one as a patient does well unless they have an engaged caregiver. So really, I think that we want to be caring about our caregivers as well. So everything I said from a wellness standpoint also applies to you, and really that oxygen mask of taking care of yourself if you are a caregiver before you sort of care for anybody else is really so key. So I hope that some of this has actually resonated with you. I am spending this year with an opportunity to learn around some more mind-body practices in this contemplative medicine fellowship. I'm actually doing this. I won a scholarship to study with the New York Zen Center as a healthcare provider who's learning about these practices and how to use them to help our Parkinson's patients. So stay tuned for the next installment of our wellness chats, because I really am learning more and more every week and doing a lot of study to help bring some of these practices to you and your families as well. So I thank you so much for the opportunity to speak to you today. And I just really hope that, we can all sort of work together to really end Parkinson's disease. I urge you to think about, in finding your purpose, connecting with fellow Parkinson's patients. I think this is hugely helpful to many of our patients. And Tim Haig, I know, is giving a talk that is very similar to many of the things that I've drizzled in here. Think of reading this book, Ending Parkinson's Disease, and getting into this activism advocacy space can actually be a very helpful way to find meaning. And I thank you for the opportunity to speak to you all today. It was a pleasure. And I just hope that you can all take something away and, thinking about this cultural context, finding ways that are accessible to you and maybe sharing those with each other, because I think if it works for you and you can find some ways to make yourselves feel better, improve your own quality of life, it doesn't hurt to talk about this with others and really share what is meaningful and what has been helpful to you, so that we can, all as a community, improve the quality of life for all of our patients worldwide with Parkinson's. Thank you so much. Be well.